Hi, I'm Mark Cooper, board-certified gastroenterologist, and we're covering in depth those topics that you may have not been able to discuss in clinic. Today, a very common question: why is my PPI, or proton pump inhibitor, not completely resolving my heartburn? Heartburn is the discomfort that occurs in your chest when food contents and acid in your stomach reflux up into your esophagus, causing pain. Heartburn is a very common symptom. Good 1 in 5 Americans experience it, and there's a lot of over-the-counter options to treat it. Many people will start with an antacid and then may choose another over-the-counter medication such as Pepcid, but increasingly they can find a proton pump inhibitor over-the-counter such as omeprazole or pantoprazole. Some of these medications are only prescribed, but because they're so frequently started even over-the-counter, people don't have a lot of clarity on how to best use them to achieve the best results. And so that's where I want to start out with the first tip on how to correctly take a PPI, because it's paramount to having any success with that at all. And this is based on understanding how your stomach actually works. Your stomach responds to food by producing acid. Producing acid takes a lot of work, and so while the stomach is usually making a little, it's not until you eat that it produces an eruption of acid in response to begin the digestion process of your food. And so to head that off, we need to be making sure that we're taking a proton pump inhibitor prior to eating. So this is why we take the medication 30 to 60 minutes before a meal to give it time to absorb and be ready to work, so that when you do eat, no acid is produced, which makes your stomach a much calmer environment, so there's not all that acid content to reflux. So you want to be taking the medication 30 to 60 minutes before your first meal of the day, and that's different for different people. For most of us, that's breakfast, but if you're someone who works nights, you may be waking up late in the evening, and so you actually want to take it there before whenever you start your day, or if you have a later breakfast, take it a little bit later in the morning. The goal here is to ensure with that first meal, we don't produce that eruption of acid, and then the medication sets in and it'll work throughout the rest of the day. And the next thing to consider is, are there any alarm symptoms which would really drive you to go to your physician and have a discussion about whether you need a procedure called an upper endoscopy or an EGD. Alarm symptoms include the new onset of these symptoms a little bit later in life, especially after 50, if there was any family history of stomach cancer, or if there was any alarming symptom like you had trouble swallowing, or if you're actually vomiting, especially blood, then you really need to be engaged in the physician's care and looking at getting an EGD, a procedure that we talk about in another video. So if you do go and visit a physician's office, one of the things that they're going to be discussing with you is some alternate causes of having heartburn. The first thing to consider is there's other organs that live in this area. This is high dollar real estate. Your heart and lungs may often be causing symptoms that can be a mimic of heartburn. And so we certainly don't want to be missing something like a heart attack and mistaking it for heartburn. The other things to be considering is whether you might have an infection in your esophagus, an autoimmune condition called eosinophilic esophagitis, or you might have a structural problem called a hiatal hernia, which means that you're going to be much more prone to having the acid contents in your stomach reflux back up. These are things that we need to investigate with an EGD or perhaps other medical diagnostic tests. So once we've established that this is really just stubborn heartburn that's not fully responding to a proton pump inhibitor, we have to look at other lifestyle changes that you can make to support resolving your symptoms. Certain foods can trigger acid reflux. This is in part because it causes your esophagus to be more prone to relaxation, so there's more reflux of the food contents. Different people are sensitive to different foods, but very common are going to be tomatoes, orange juice, coffee, minced chocolate. And so these are things that you may want to have earlier in the day while you're up moving about, so that they don't tend to cause as much irritation, because very often people experience the worst symptoms at night for the simple reason that they're laying down, and so food doesn't even have to travel up, it just washes back while you're laying down. One way to improve that is to actually raise the head of your bed. And so you can get some wooden blocks and simply place them under the feet of your headboard, and that'll elevate the head of the bed. And that will reduce reflux events, giving you a more comfortable sleep. A lot of people take NSAIDs. These range from ibuprofen or naproxen and a host of other medications. These can irritate the esophagus, as can other medications. And so if you take these, ensure that you're doing it with a full glass of water so that it's well washed down the esophagus. If you have a hiatal hernia, this may need to be surgically repaired, but a big portion of causing a hiatal hernia is being overweight. If you have a lot of excess fat around the abdomen, then that's going to push the stomach up into the chest, worsening those symptoms of the hiatal hernia. You'll have a more successful surgery if you choose to have one, if you're able to lose weight, and you might even find that losing weight moderates a lot of the symptoms to not even necessitate a surgery. So losing weight and exercise is also helpful for improving your symptoms. It's also very key that you moderate alcohol, and if you've had any trouble with quitting tobacco, this is one more reason to do so. Because not only does tobacco affect your lungs, but it also affects the esophagus and the stomach, because the same carcinogens make their way down your eating tube just as they do your breathing tube. So please consider stopping smoking. Now, I myself sometimes get some heartburn, and so I'll take a PPI ahead of those meals that I know will make symptoms worse. And the other thing that I'll do is I'll have those heavier meals, like my mother-in-law's delicious ribs, at a lunchtime, so that I have the rest of the day to digest them, so when I go to sleep, it's not a problem. So that's another thing that can help you indulge in some of your favorite foods without having to compromise certain aspects of what you most enjoy. In conclusion, I want to remind you this is general advice, and like I talked about, there's some alarm symptoms that you should really seek out medical care for. So this is not diagnostic, nor is it intended to be specific for any person. But we do hope that you found this informative. If you've decided to start a PPI over the counter, it hopefully gives you some tips on how to make sure you're taking that correctly. And if you enjoyed this video, please subscribe to explore some of the other content or seek out some of the other videos that discuss the conditions that we've raised here. As always, thank you for your time. I'm Mark Cooper,